So quality standards for administration. First, the quality standards we will discuss is for staff qualification and education. Okay. When you're hiring staff for working in your hospital, okay, what all things you have to look, what all quality standards you have to follow when you are filtering out their qualification, okay, and you are verifying their educational certificates and all. Okay. First and foremost, you have to plan what exact educational skills, knowledge, or other requirements, other specific requirements you want in your staff. Okay. If you are searching for a nursing assistant, okay, or assistant to a ward in charge, should she be from a BSc nursing background or a GNM background or a post basic nursing background, A&M, okay? So you have to decide, okay, you have to decide the maximum education you require for a particular post. When you are creating a post, you have to discuss desire you have to discuss that what exact educational qualification should be there for a person whom you are going to select for this post, what skills they should have, what kind of knowledge they should have, or what other requirements like certificates, diploma certificates, okay, or some training that they have done, okay, what are the requirements they should bring to your organization. You have to decide that, so you have to plan for that. Only when you plan it, okay, you can post it, you can post a vacancy on various platforms, and you can get the hiring started. Okay. The second step is determining the medical staff membership. Okay. Who will have the membership, which all, how many years a staff has to spend in your organization to get the staff membership. Okay. So these are certain privileges that some hospitals give to their medical staff if they have completed 3 to 4 years or 5 years in an organization. They will get better compensation, or they will get some bonus, retainment bonus, something like that. Okay. So it depends upon organization. It is different from one organization to other as well. So you have to determine how are you going to give a medical staff membership. Okay. Depends on nurses, doctors, anyone. Then the assignment of medical staff clinical privileges. Who has the duty to give an injection? Who has the privilege to give a prescription? Okay, who has the privilege to open even a clinical file? Okay, if you are not from a medical field, you do not have the right to go and just take any file from the shelf, okay, patient file from the shelf and start reading. Okay, you have to be from a particular clinical background to access this information. Okay. So as a quality manager, you have to assign which medical staffs have which kind of clinical privileges. Okay. For example, nurses cannot give prescription. Nurses can only carry out prescription. Only doctors can give prescription. Okay. So like that, these are the clinical privileges. Ongoing monitoring and evaluation of medical staff members, even after you have hired a staff, it's a new staff, a fresher staff. Okay. While they're on their job, you have to monitor them, how they're working, how their skills are, what more training they may require, how well they are trained. Okay. You have to evaluate them, you have to monitor them. Okay. When they're on their work. Okay. You can do medical audits as well to get the data. Then medical staff reappointment and renewal of clinical privileges. Okay. This is like, for example, some retainment bonus documentations may have to be renewed. Okay. Some work documentations, hiring documentation may have to be removed. Some privileges has to be may have to be renewed. Okay. Parking privileges, food privileges. Okay. This could have been renewed. If they have received a promotion, based on the promotion, there is some renewal in the clinical privileges as well. Okay. So that would change. So you have to check that renewal as well. Sometimes you have to renew their licenses also, their registration or licenses you have to renew. Okay. Nursing staff also, you have to look for their qualification, Are they registered nurses? Is the registration remaining? Have they completed their BSc nursing, post BSc nursing GNM? Okay, so certificates ready. Okay, these things you have to tally out. And even for other healthcare practitioners, physiotherapists, radiographers, technicians, lab technicians, okay, for everyone you have to follow the same thing. You have to verify their educational credentials, their skill credentials, other diploma certificates that they have done. You have to verify these credentials as well. Okay. So do you have any doubts so far? Do you have any queries here? Is it clear to all? Next is quality standards for medical records management. Okay. So when you are dealing with the medical records of the patient, okay, or when you are creating a medical records procedures or process or system, you are a part of renewing the system of MRD. Okay, what kind of quality standards you have to bring in for the smooth work practice of this department? So use an identifier that is unique to the patient. No two patients should have a same identifier. Every inpatient number should be unique. Every outpatient number should be unique. It should not be repeated. Okay. So the patient identifier is the inpatient number, outpatient number. These are identifiers. You cannot repeat the same thing. Otherwise, it will lead to a lot of confusion. Okay, that could lead to medical negligences, also malpractices as well. Okay, so when you are using an identifier, let it be unique. Only one specific um, a combination of alphabets or numericals, whatever you are using, but it should be unique to that patient. It should not be repeated, like barcode. Okay, what specific content you want in the medical record, in what format you want it. Okay, like when the patient came, what complaints they had, how the physical examination was done. Okay, provisional diagnosis, then conclusive diagnosis, vitals. Okay, other charts, TPR charts, and so on. Okay, there is a format in which a medical record is arranged, form after form. Okay, there is a format in which all the forms have to be arranged. It has to be followed. You have to follow the same format in all the departments. Okay, location of entries for medical patients medical record. Okay, it has to be in a specific format that has to be followed. You have to check that your staffs are following this format. If they are not, you have to ask them to do it. Okay, then adequate information to identify patient, support diagnosis, justify the care and treatment to the patient. Okay, like if they have if a doctor has made a provisional diagnosis or conclusive diagnosis, there should be enough rationale in the medical record that leads to the diagnosis. Just from the air, a doctor cannot pick a diagnosis and put it in the medical record. Okay, there should be a concrete rationale, okay, concrete reasoning in the medical record that supports the diagnosis that the doctor has made. Okay, even if tomorrow the diagnosis is wrong, but the factors that led to the diagnosis should be concrete. Okay, and it should justify the care and treatment that you have given to the patient. Like unnecessary test was not done, unnecessarily medications was not given, unnecessarily you did not increase the stay of patient. Okay, so these justifications should be there, should be found in the medical records. Time of arrival of patient, at what time they departed, or they departed from the ward. Okay, what conclusions, discharge summary was given or not, what kind of discharge summary was made. Okay, follow-up care was given to the patient or not, what was it explained to the patient or not. Okay, even in emergency cases. Okay, all these um, processes were done or not, you have to check. That comes under the quality management of medical records. Coming to the quality standards for electronic medical records. Okay, when you are using electronic medical records, when you are using electronic medical records, it is completely hospital information software based. Okay. So when you are given a chance to choose a software for your EMR, electronic medical records, make sure you choose a software which has minimum to zero copy paste option. Okay. Because a lot of malpractices can be done if you have an active copy paste option. If you see some websites, you cannot copy paste the content. Okay. The same format can be applied in your software, hospital software, electronic medical record software. Okay, so choose and process the proper use of copy paste. Copy paste to some degree will be available, but make sure when it comes to typing out the patient's condition, okay, the patient's current situation, copy paste is not involved. Okay, educate your and train your staff. Not all staffs may know how to use EMR. Okay, you may have to give some interactive training to them. Okay, some may not be even comfortable using a laptop, notepad or a computer. So you have to make them, train them to use these gadgets. Okay, you have to monitor the compliance with the use of copy paste guidelines, even though you have minimum copy paste options, but wherever the copy paste options are active, okay, see how the staffs are complying with it. Okay, ensure the accuracy of EMR. Okay, how accurate information has been registered. Sometimes if the temperature was checked at 7 p.m. and if it is entered by 11 p.m., okay, that is not accurate. Okay, at 7 p.m. you have checked the temperature. Within 10 minutes, it has to be entered. Okay, that is an accurate information. Assess the patient's EMR content and completeness. Make sure each and every page is complete, but in EMR, it is very easy to ensure completeness, because if certain areas of the form is not filled, you cannot submit it. You cannot submit or save the data. To save the data, you have to complete the form. Only then you can save the data. Reviews are done quarterly. Physicians do the review. Nurses and others, they're authorized to make the entries. Now, nurses also have, physicians and nurses, and even whoever has the access to electronic medical records, they have their username and login ID. Okay, so that they cannot do any malpractices. Okay, under the name of somebody else, if they are typing something in the EMR, it is not allowed. So a unique username and ID is given to nurses and doctors, whoever is authorized to make entries. Reviews will focus on timeline, legibility and completeness. When you do a audit for electronic medical records, you check for the timeline, means exactly when the care was done, okay, at what time the care was done, and what time the entry was done. As I mentioned earlier, at 7 p.m. of temperature, TPR was done, temperature, pulse, respiration, the BP was checked. Okay, you can't do the entry at 11 p.m. It has to be done within 10 minutes when you have done the actual activity. Okay, so the timeline has to be reviewed. Legibility, okay, when whatever you are typing out should be spelling corrected. Okay, it should be complete. No important areas in an EMR should be missed, otherwise you cannot print it. Is it clear to all till EMR? Then coming to the quality standards for human research. If your hospital does any researches in which humans are the subject, okay, what kind of quality standards you will have to follow. So hospital leadership is accountable for human research subjects, okay. Whoever is the hospital administrator or the top manager, okay, he or she should make sure that all the rights of the human research subjects are being taken seriously. Okay, you have to comply with all the regulations and professional requirements, and you should also provide adequate resources also to conduct any human research. A lot of regulations come into play when you are doing any research on human beings, okay, human subjects. And also a person who is going to do this human research, they also have to fulfill certain professional requirements, okay. So based on certain degrees, courses, okay, some educational qualification if they have, experience, work experience if they have, only then they are allowed to do human research, okay. Hospital leadership established the scope of research program, requirements of sponsors of research, conduct ethical research. Okay, that is also the role of hospital leadership. Okay, what is the benefit of this research? If you are doing a specific research on a topic, a cancer drug or something like that, okay, what is the scope of this research? How can it benefit your organization? How can it benefit the community? How can it benefit the hospital, the healthcare, the medical practices, okay, the pharmacy, okay, these all come under the scope of research program, okay. It should not be very narrow scope. It should have every research, make sure whatever research you do or whatever research you allow to do, it should have a broader scope in the future. Requirements of sponsors, whoever is funding the research, okay, what they want out of the research should not interfere with the ethics of conducting a research. Sometimes if if a pharmaceutical company, for example, you are researching the effectiveness of a specific drug, okay, in cancer, and a pharmaceutical company who has come up with this drug is the sponsor of your research, there are high chances that it may not turn out to be an ethical research. Even if the drug is substandard, the sponsor, the funder will force you to put more appropriate research that suits their interest, okay. So make sure you have sorted or you have filtered out sponsors in a way that sponsors interest is not causing a bias in your research, okay. Whoever is giving you money to do the research, their interest should not lead to any bias in your research, okay. And you have to conduct ethical research, okay. Ethical research, basic thing what you can follow is whatever is the patient's 11 rights, the same you have to follow with human research as well. Human subjects will also have the same 11 rights what the patients have in hospital, okay. The same thing you have to apply here, so you will automatically conduct an ethical research. Accountabilities of outside contract research organizations are clearly defined. Who all are within the contract, who all are outside organizations, who are financially interested in the research, okay, what is the purpose of their interest, okay, these things has to be clearly defined, okay. Funding the research is one thing, but your personal interest creating a bias in the research will not be appropriate. You have to create contracts, okay, that is consent. You can take a consent form, the same like how you take with patients. Informed consent has to be taken from the human subjects. Identify and manage conflict of interest with research conducted at the hospital, because sometimes the hospital, if it is coming up with a drug or the hospital is coming up with a treatment strategy, okay, the hospital wants name and fame out of this treatment strategy, but if the research is not showing positive results, okay, that could lead to conflict of interest. So you have to manage that, okay. You have to be as ethical as possible towards your research. Integrate human subjects research program into the quality and patient safety program of the hospital. As I mentioned, whatever rights of patients you is available, the same rights will be applied to human subjects in research as well. Whatever patient safety um, standards you follow in the hospital, the same patient safety standards will apply to the human subjects in the research as well. Informed consent is taken. Also, every patient should have an access to clinical research, okay. Whichever patient is in need of any and whatever therapy or treatment, if there is a research going on, they should have the option to take part as a human subject, okay. Even though if the drug is under trial, but if there is a drug that could save the patient and the family should be given the option of going under a trial. So that's about quality standards in administration.